Good afternoon, everybody. Joining me today are Brigadier General Janine Burkhead of the Maryland National Guard, Dr. Ted Delbridge, who's the Executive Director of the Maryland Institute for Emergency Medical Services Systems, and Dr. David Marcosi from the University of Maryland Medical System, who serves as our Senior Medical Advisor on COVID-19. For nearly a year now, in our battle against COVID-19 pandemic, our primary goals have been saving lives and keeping our hospitals from being overcrowded. Thanks to our early and aggressive actions, which we redoubled in response to the fall and winter surge, and thanks to the continued vigilance of Marylanders, we have seen significant improvements in all of our key statewide COVID-19 metrics. Over the last 4 weeks, the positivity rate has dropped by more than 46% to 5.08, which is the lowest since November 8th. The case rate per 100,000 has dropped by more than 60% to 20.9, the lowest since November 9th. 20 of the state's 24 jurisdictions have now dropped out of the red zone for cases per 100,000 as designated by the federal government. The case rate has dropped across all age groups, with Marylanders 65 and over, who are the primary focus of our current vaccination efforts, showing the biggest drop over the last 4 weeks. COVID hospitalizations have declined each week for the last 4 weeks and have dropped by 34%, from nearly 2,000 to 1,272, the lowest number of COVID hospitalizations since November 22nd. This decline in hospitalizations is consistent across all regions of the state. The 7-day average for deaths has decreased by 26% just over the last 2 weeks. And the number of nursing homes with active COVID cases has dropped to the lowest level since before Thanksgiving. We are pushing back against this invisible enemy, and we're making great progress. However, we need to remain cautious and vigilant as we continue doing all of the things that we have helped us make that tremendous progress. As a result of all these improved metrics, we're able to take additional steps for all our families who have been unable to visit their loved ones in hospitals and nursing homes, and to try to provide them with some much needed relief. In coordination with the Maryland Hospital Association, the Maryland Department of Health will be issuing orders to allow for limited visitation to resume at Maryland hospitals, subject to the policies set by each facility. In addition, state health officials will also issue guidance which will provide for limited indoor visitation at Maryland nursing homes beginning March 1st, with proper testing protocols in place. The state superintendent of education and I called on county school systems to give students the opportunity to get back into the classrooms in the coming weeks. Since that announcement, there has been a great response all across the state. As of today, 22 of our 24 county school systems have already begun in-person instruction or have agreed to do so by March 1st. In addition to the guidance that state health officials provided last month, CDC officials will provide additional federal guidance this week, I believe tomorrow, on steps to get school systems safely reopened. Similar to the Maryland Department of Health's policy, the CDC does not require that teachers need to be vaccinated in order to return. However, here in Maryland, that process of vaccinating teachers is already underway. Today, we're announcing additional support to promote and facilitate school reopenings. The Maryland Department of Health and the Maryland State Department of Education have offered to provide nearly 1 million COVID-19 tests to local school systems between now and the end of June. This testing program, which will include both rapid antigen tests and full diagnostic testing, will be available to any public or non-public schools that want to launch a testing program or that want to supplement an existing testing program. We're also offering an unlimited supply of PPE to all schools. And we are, in addition, distributing more than $1 billion in funding to help more children get safely back into the classrooms. I want to commend all of the teachers, administrators, parents, and public health officials who are doing everything they can to give Maryland students the chance to get back safely into the classrooms. Throughout this week, I've been in daily discussions with White House officials, along with many of the nation's governors, about ways to get the federal government to provide us more vaccines to the states. On Tuesday, I urged the Biden administration officials to consider utilizing the Defense Production Act to harness the power of American manufacturing and to get more pharmaceutical companies involved in manufacturing more vaccines. Yesterday, I was part of a call with the Executive Committee of the National Governors Association. As a result of that discussion, today we are issuing a letter requesting that the federal government more closely coordinate with the individual states regarding the allocations that they are sending directly to pharmacies and other providers. In addition, yesterday, Governor Northam, Mayor Bowser, and I asked federal officials to take a more direct responsibility for vaccinating the hundreds of thousands of essential federal employees in the National Capital Region. And tomorrow, I will be in the Oval Office with President Biden. Every state, every county, and every city in America is facing the exact same problem. We are simply not receiving enough vaccines to meet the demand. Federal guidelines and our state policies currently make 2 million Marylanders eligible for vaccines. The state of Maryland only receives approximately 11,000 doses per day. Unfortunately, just because you may be eligible does not mean that a vaccine or an appointment for a vaccine is currently available to you. And we've been told by the federal government that this problem will continue to exist for the foreseeable future. I know that this is extremely confusing and very frustrating for everyone involved, especially tens of thousands of our older residents who ask every day, why can't I get an appointment scheduled? The fact is, they can't schedule an appointment for a vaccine that does not yet exist. The basic problem is pretty simple. We need more damn vaccines. If I needed to drain the entire rainy day fund to buy enough vaccines for every eligible Marylander, I would do so today. Unfortunately, we have no control whatsoever over this supply problem. Only the federal government can buy the vaccines, and only the federal government can send us the vaccines. What we can do, and what we are doing every single day, is rapidly scaling up the infrastructure to utilize every single dose that we are allocated, and to vaccinate as many people as possible, as quickly as possible. 6 weeks ago, Maryland providers were averaging about 3,000 shots per day. At the time, the state allocations were being deployed primarily to hospitals for their frontline healthcare workers and to 24 local health departments for them to vaccinate their own first responders, and critical healthcare workers. The process was way too slow. To increase the pace of vaccinations, we deployed vaccines to more and more providers in every county. We stood up special National Guard vaccination support teams, assigned Maryland Response Medical Reserve personnel to county clinics. Clinics were set up at every single nursing home in Maryland, 279 of them, and at assisted living facilities all across the state, and every congregate living facility in the state. Both the federal and state government began pilot programs to make vaccines available in neighborhood pharmacies. We opened mass vaccination sites in central locations, and we dramatically expanded the provider and vaccinator network, which now includes not just 24 local health departments and 80 hospitals, but more than 2,300 points of distribution. As a result, Maryland increased the number of vaccines administered by more than 770% over the past 6 weeks, and is rapidly accelerating our daily rate of vaccines administered from 3,000 a day to now averaging a record high 26,211 shots per day. 100% of all the doses allocated to the state of Maryland have already been distributed to providers, and 78% of all first doses received have already been administered. Most of the rest of them are already scheduled and spoken for. As of today, Maryland has administered 785,170 vaccines to the 2.1 million Marylanders who are currently eligible. At this point, we are simply waiting every week for more vaccines to arrive. Everyone who lives or works in a Maryland nursing home has been offered a vaccine. The clinics in most assisted living facilities are now complete, and clinics are currently underway in all the other independent living facilities across the state. We are doing vaccinations currently at more than double the current supply that we are being given. And we have built an infrastructure that is able to administer anywhere from 50,000 to 100,000 shots per day as soon as they are made by the manufacturers and allocated to us by the federal government. Following both the federal and state vaccination plans, we are continuing to broaden the distribution network to ensure as many points of access as possible in each and every county. Some local leaders have indicated that they want us to go backwards and to simply give the 24 local health departments sort of a monopoly on all the doses. That is absurd and is simply not a realistic way to vaccinate millions of people all across the state. While approximately 30% of each county's total allocation does go to a local health department, approximately 70% of the doses in each county are being done by others at the other 2,000 distribution points, including hospitals, pharmacies, community health centers, nursing homes, assisted living facilities, and other congregate care settings in each of the counties. This is what the state's plan and the Biden administration's plan have both always called for. So here's just one example, if you look on the screen here, of how this works, how this growing network works to get more shots into more arms. 89,000 doses have been administered to Montgomery County residents across hundreds of points of distribution. 27% have been vaccinated by the local health department. and 73% have been done by others. So when you hear, which we've heard over the past week or so, county leaders say, we only get X number of doses for our county, it's false. They're actually referring to what their local health department received, not what their county has received. So we're providing far more vaccines for every single county across way more providers. The federal and state plans call for more points of distribution, not less. Of course, we fully understand their frustration because no state, no county, no local health department, no hospital or pharmacy has enough vaccines yet. And we do need far more vaccines for every single provider, from hospitals to pharmacies to local health departments. And we're all in this together, and that's what we're all pushing for. Another area where we agree with local leaders is on their request for more certainty on the allocations with regard to the weekly allocations for their local county health departments. Earlier this week, at the direct request of myself and other governors, the nation's governors, the CDC officials have now agreed to begin providing states with 2-week allocation projections instead of 1. Up until now, state health officials have had to wait until Thursday, Friday, or sometimes even Saturday night of each week to know what we could allocate to anyone for the following week. I've now directed the Maryland Department of Health to provide county officials with 4-week allocation projections so that they can plan ahead and can open up more appointments for their clinics. We will also continue to increase allocations to each county across all the providers in those counties, including pharmacies, hospitals, and local health department clinics and others, as the vaccine supply increases. And those allocations will be made equitably based on the population of each county. The Six Flags and Baltimore Convention Center mass vaccination sites in their first week are on track to vaccinate more than 15,000 Marylanders, which is 100% of the doses they have been provided. Right now, we can do thousands more per day at each of these sites immediately, just as soon as we receive higher allocations from the federal government. Residents from 22 of the state's 24 jurisdictions have already been vaccinated and or scheduled for appointments for vaccinations at the state's Six Flags site in Prince George's County. At the same time, we also continue to prioritize appointment slots for eligible Prince George's County residents, and we're reaching out directly to pre-registration lists provided by county officials, making thousands of calls and contacting them for these priority appointment slots. Each week, we set aside dedicated appointments for county residents to ensure equitable access. In partnership with the University of Maryland Medical System, the state's mass vaccination site at M&T Bank Stadium will open 2 weeks from today, on Thursday, February 25th. Appointments for the site will become available sometime next week. We are also finalizing additional mass vaccination sites in Western Maryland, in Southern Maryland, and on the Eastern Shore. And we will be ready to open them next month as more vaccines become available to us from the federal government. For updates on when appointments for mass vax sites will become available, I encourage Marylanders to text MD Ready to 898-211. In addition, next week we will also be launching a statewide call center to assist Marylanders with making appointments for mass vaccination sites. You can also visit covidvax.maryland.gov to find more information for each of the vaccination providers in your area. Because the supply remains so limited, vaccinations can only be done by appointment. And I just want to caution people that all appointments will continue to fill up very quickly. For example, the initial 10,000 appointments that we made available to members of the public at the Six Flags site were all completely reserved within 20 minutes. We simply cannot schedule appointments for vaccines that we do not yet know that we will receive. From the beginning, we've been focused on ensuring equitable access to vaccines, especially for populations that have been disproportionately affected by COVID-19. In the interests of public health and transparency, Maryland was one of the first states in America to publish comprehensive racial data for COVID-19 vaccinations. It shows that one of the biggest problems facing us is significant vaccine reluctance and hesitancy in minority communities. As the state focuses on mass vaccination, we're calling on county health departments who know their communities best to help us reach hard-to-reach areas and underserved populations. And General Burkhead, who is the head of the Maryland Vaccine Equity Task Force, has requested that each county appoint an equity officer to serve as a liaison to her in order to closely coordinate on equity initiatives. In addition, General Burkhead and the task force, along with the equity officers appointed from each county, will all be working with local organizations and clinical partners to stand up mobile vaccinations and pop-up clinics to reach critical populations. Equity will be a constant focus for us at the state level in the weeks and months ahead, and we're calling on local leaders across the state to also make this a top priority as well. I want to wrap up by thanking all of our vaccinators who have been working around the clock to get those 785,000 shots into the arms of our most vulnerable. And I've had the opportunity to speak to many of them, and I can assure you that they are just as anxious as I am to receive more vaccines so that they can accomplish even more. On that front, there is some exciting news on the horizon. On Monday, I visited the Emergent Biosolutions facility in East Baltimore, where millions of doses of the Johnson & Johnson vaccine, a single-dose vaccine, are already being manufactured. This vaccine candidate is currently under review by the FDA, and the federal government told us a couple of days ago that they anticipate that this should be approved by the end of this month. This could very well be a major breakthrough in terms of increasing the supply of vaccines. And we're very proud that a Maryland company will be a part of that. But even with this good news, this will continue to be a long process for many months before any of us have the amount of vaccines that we all need. We are fully prepared to allocate, deploy, distribute, and utilize every single dose that we are allocated. And I will not rest until a vaccine is available for every Marylander who wants one. We will continue to provide daily updates on the progress, and we urge Marylanders to please remain patient and to please take the vaccine as soon as one becomes available to you, so that we can keep ourselves, our friends, and our communities safe, and that we can finally bring this pandemic to an end. We're all in this together, We will get through this together. At this time, General Burkhead will provide an update on our vaccine equity initiatives.
Good afternoon, Marylanders. Thank you, Governor Hogan. As you all may know, I received my first dose of vaccine, and I will receive my second dose very soon. To share a personal story, it was not a foregone conclusion that my own mother would take the vaccine. After many conversations, continued information sharing, she decided to go for it. Now, like others in her age range and risk category, she is waiting her turn. Thankfully, I was able to overcome this distrust with transparency and education. As I am a trusted voice for my mother, they are trusted voices in the community. Part of my task is to reach those trusted agents, give them a platform to provide pertinent information to friends, families, and loved ones. This is what the Equity Task Force will be for people like my mom and for people like your families. A reliable, trusted source of information. In part, that means sharing your personal stories with friends and neighbors and families. But also, I need leaders at the grassroots level to play a vital role. Faith leaders, elected officials, community organizers, and other social leaders have a huge part to play. They also are the people best situated to know where the vaccine is getting and where it isn't. And I look to them to help me solve that problem. I want to especially thank the local health departments for working tirelessly on the vaccine effort because I know they know their communities best. The Equity Task Force will only add, support, and amplify their efforts. This is an all-hands-on-deck response, and we are actively engaged. The Vaccine Equity Task Force is here to make sure every Marylander knows the facts and facilitate the opportunity for vaccination in underserved communities, vulnerable communities, and at-risk groups. Equity matters. With targeted investments in education, outreach, vaccine locations, we can mitigate the impact of inequality of the vaccine and what we're seeing in the uptake of vaccine. The Equity Task Force is energized and engaged, and we're looking forward to working with you and your community. I will be followed by Dr. Delbridge. Thank you.
Good afternoon. Thank you, General Burkhead. Thank you, Governor Hogan, for your unwavering leadership. I'm going to change gears just a little bit. Through last summer and fall, we pursued efforts to help Maryland hospitals prepare for a potential wintertime surge of COVID-19 patients. Today, we sense with optimism that we have weathered this most recent phase of the storm. To be certain, the approach has been an all hands on deck. It has represented the efforts of all aspects of state and local governments, healthcare systems and hospitals, frontline healthcare workers of all sorts, and to be certain, the general public. Hospitals exercised creative innovation to optimally care for as many patients as they safely could. We maintained and increased capacities at ancillary care sites in partnerships with hospitals in Tacoma Park, Laurel, and the Baltimore Convention Center Field Hospital. Working with every single school of nursing and respiratory care in Maryland, we have credentialed more than 1,300 nursing and respiratory care students as clinical externs. Many have been able to make contributions to the healthcare system. The remainder are on deck and ready to help. We stood up the Critical Care Coordination Center, helping to match the intensive care needs of individual patients with available resources throughout Maryland. Nearly 600 people have been helped. As of this morning, as Governor Hogan mentioned, there are 1,272 COVID-19 patients in Maryland hospitals. The number of hospitalized patients has been declining since it peaked on January 11th. As other indicators improve, we are optimistic that hospitalizations will do so as well. Improvements in the care of COVID-19 patients have led to fewer patients in intensive care units. During this most recent surge, less than 25% of hospitalized patients required ICU-level care, compared to 40% in the spring. This change undoubtedly helped our hospitals respond well. We are, by no means, out of the fight, and we have quite a way to go. However, we are optimistic that COVID-19 hospitalizations will continue to improve in the near term, and that's a good news story. We also remain vigilant with no plan to stand down. Finally, without question, hospitals and emergency departments are busy doing the work they always do. However, they remain, as always, ready to care for sick and injured people. With that, I reiterate, do not ignore important symptoms, things like chest pain, shortness of breath, or sudden weakness. These could be warnings of serious problems that deserve prompt attention. Please do not delay. Thank you. And with that, I'll turn it over to Dr. David Marcosi, who's the Incident Commander for the University of Maryland Medical System and advisor to the Governor. Dr. Marcosi.
Governor Hogan, Dr. Delbridge, General Burkett, fellow Marylanders, good afternoon. Just over 1 year ago, although it seems much longer to many of us, our country declared a public health emergency due to the coronavirus outbreak. Within this time, the U.S. has realized over 27 million positive COVID-19 cases and 486,000 deaths. Staggering numbers. Since the start of this pandemic, we have weathered personal protective equipment shortages, testing shortages, school closures, surging patients needing hospitalization, and holidays without friends or family members. Importantly, though, also within this past year, we have and continued to persevere during challenging times. We learned how to protect ourselves and show respect for each other by wearing masks to prevent the spread of this virus. We realized that we are all in this together and stayed connected to assure that no one feels alone during these anxiety-provoking times. Finally, within this past year, vaccines have been developed and are now being administered to protect us against COVID-19. The step the governor announced today to allow for increased hospital and long-term care visitations is an important one. The restricted visitation policies put in place previously were necessary to protect patients, families, and hospital staff due to our limited understanding of the evolving COVID-19 threat. But we've always recognized this is yet another stressor on someone who needs hospitalization. All of us are keenly aware, from hospital admission to discharge, family members and care partners are a critical component to a patient's recovery. Understanding this, if long-term care facilities and hospitals elect to relax visitor restriction policies, facilities must confirm that personal protective equipment supplies are sufficient and robust infection control practices are in place to assure continued safety of patients, staff, and visitors while embracing a holistic approach to a patient's healing. I'd like to briefly address two questions that have been noteworthy recently. The first one is, will the Johnson & Johnson vaccine protect me like the Pfizer and Moderna vaccines do? First, we should all be excited for the potential of another vaccine. The more vaccines that are available, the more quickly we can all get vaccinated. All of the COVID-19s, including the J&J vaccine that submitted for emergency use authorization on February 4th, have proven to be effective and safe, and they prevent hospitalizations and death. Specifically, in the United States, the J&J vaccine was shown to be 72% effective against both moderate and severe COVID-19 infections and provided 100% protection against hospitalizations and death 28 days from vaccination. This is truly good news. What is unique about the J&J vaccine is that it can be stored at normal refrigeration temperatures, which means that it will allow for more opportunities for additional vaccine administration locations. The side effects of J&J vaccine are similar to the other COVID-19 vaccines and include site injection pain, fatigue, headache, muscle pain, joint pain, and on occasion fever. These side effects are a sign that our immune systems are kicking into gear, and they are normal, and should be expected after vaccination. If this vaccine receives EUA approval, it will be a significant step forward and enable more of us to be protected from COVID-19. That said, the chance is never zero that you won't get COVID-19 after being vaccinated. But all of the vaccines, Pfizer, Moderna, and hopefully J&J, will reduce the severity of symptoms and prevent both the need for hospitalization and, most importantly, they will prevent deaths. The second question that may need clarity is around masking. Should I continue to wear a mask after I am vaccinated? Do I need to take other precautions? And what about this double masking that I'm hearing about? Yes, we will all still need to wear masks after vaccination until the majority of us are vaccinated. I know this may seem counterintuitive, but here is the reality. The vaccine will protect you from getting sick, but you could still spread it to those who might become sick who have not been vaccinated. This is even more important as we continue to see new variants that are perhaps more transmissible than the original strain. Yesterday, the CDC released new masking guidance based on a series of experiments that they conducted. It can be confusing, but the bottom line is this: the transmission of this virus is decreased when we wear well-fitting masks with multiple layers. To make sure you're masking properly, follow these simple steps. First, check your fit. Make sure your mask covers your nose and mouth and should have no gaping sides. Number two, if your mask doesn't fit, consider folding in the sides, knotting in the ears to allow a snug fit, or layering on a second mask to improve the fit and increase protection. The CDC on their website has other instructions that could be helpful in this regard. Making sure you're always fitted with a proper mask and those around you are fitted with a proper mask is also important. It has been a challenging year, and the challenge isn't over. I'd like to pause and thank our state's healthcare and essential workers who tirelessly and courageously kept going. It is because of them that we were all able to keep going. Thank you to the teachers who adapted and figured out how best to educate our children during a pandemic. Thank you to the business owners who realized the seriousness of this threat and saved lives by modifying their operational models. This virus continues to change and try to get the upper hand on us. But our collective actions, all of us, are making a difference. Governor?
With that, we'd be happy to take some questions. Yeah, look, we were very pleased that the Relief Act passed unanimously in the Senate. We've been talking with the presiding officers for more than a month about this. This is emergency legislation that is desperately needed to put money in the pockets of individuals and small businesses that are in need. And we've been working in good faith with both the House and the Senate on our shared priorities, and we were prepared to be ready to sign that bill into law so we could start sending things out. We just heard today, out of nowhere, the House proposing something which I haven't even heard the details of yet, but I can just assure you that any attempts at distractions or delay will prevent this desperately needed relief from getting out to Marylanders, and it's an unfortunate occurrence. We hope that together with the Senate we can talk some sense into the House, but we look forward to getting this historic Relief Act through. If the House has some other ideas about doing other things, perhaps they should do that with a separate piece of legislation.
Actually, on that point, one of the things that's being proposed is to include undocumented immigrants as people who would receive
anything that they do to attempt to change the bill that's already been passed unanimously by the Senate, that's been discussed with the Speaker and the Senate President and myself for a long time, it threatens the bill. And anything they want to do along those lines, I think it's like they're talking about $5 million out of a $1.7 billion tax and spending relief package. They ought to just do that with separate legislation, as it was yesterday, before this latest monkey wrench they try to throw in at the last minute.
I'm sorry for a follow-up
No, I think,
So is that true?
I wasn't on the call, but, Kiefer Mitchell, who's a former member of the Black Caucus, and I had a talk with the whole Black Caucus this morning. Kiefer very clearly said to them, anything that jeopardizes this is going to harm all of the 400,000 low-income Marylanders that need the relief and threaten all of the small businesses that need help.
Governor Hogan, ahead of your Oval Office meeting tomorrow, is this as just you, or is this as part of the Governors Association and of the list of priorities that you have that you're pressing the feds for, which do you believe President Biden might be most receptive to or most surprised by?
So we just got the invitation from the White House just this afternoon. I believe it's going to be a couple of governors and perhaps a couple of mayors. It's a small group. It will be in the Oval Office. I think that the president mainly wants to talk about the Relief Act, which we're obviously very interested in. But we've been pressing all these other issues on vaccines with their entire administration, and I'm hoping I get the chance to talk about those issues as well.
Governor Hogan, Acting Secretary Schrader on Monday, I think it was, said that people should sign up for as many places as possible, as many registry lists as possible to get an appointment for the vaccine and then take themselves off the list when that happens. Do you agree with that approach? And how exactly would that work if people are struggling to get an appointment in the first place?
Well, people are going to continue to struggle to get an appointment, as we've said over and over and over again at probably the last 8 press conferences. You can't schedule an appointment if you don't have a vaccine. It doesn't matter if you're contacting the state website or a county or a hospital. We're not going to schedule something we don't have, right? So it doesn't matter how you address that. It's not going to fix the problem until we get the supply. People have to make their own decisions about their own personal health care and what they, based on their own situation and how they want to go about it. But this is the way, other than I think 3 or 4 other states, very small states that are about the size of Montgomery County or smaller, no states have one central place. And the risk we run is one central point of failure, where millions of people try to get on one website and crash it when there are no appointments and no vaccines to schedule. So it seems to be working really well. It's not working well enough because we don't have enough vaccines to schedule. But a 770% increase tells me that we're on the right track.
Governor, some hospitals have said that they're offering vaccinations to board members and their families, people who are not providing direct care, even though they may not fall into any of the open categories.
Well, that would be absolutely wrong, and we'd like to know the specifics of that. If someone's not qualified, they're not qualified. If they're not eligible, they should never receive a vaccine.
So do you mind we should only be going to the personnel in hospitals who are providing direct
No. We've asked all the hospitals to expand their provision to everyone that's in level 1A, B, and C. It's 2.1 million people. They're part of the distribution network. There are 80 hospitals that are providing vaccines all across the communities to everybody in those 3 categories.
So, for example, to follow up, Brian, Johns Hopkins has said they need to vaccinate their whole system to keep it running. Does that include like a finance guy who's been working from home for a year? Should he have a vaccine ahead of an elderly person? And we've directed these hospitals like 3 weeks ago to launch public clinics focused on the elderly. Very few of them have.
Well, I know that they're catching up. Part of it is the scheduling. I don't know what Hopkins is doing or what you're referring to. I just know what the state policy is. So if anybody's doing something that's against state policy or vaccinating people that are not eligible, then we'll try to, I'm sure the state health department will take action against them. But they are trying their best to expand. They are going out and doing partnerships with the local county governments, with the state on standing up some of the 2,000 distribution points. The hospitals are a big part of that. Some of the mobile vaccinations taking place in Baltimore City that the city announced, partnering with a number of hospitals. UMS and Johns Hopkins are standing up the Baltimore Convention Center. UMS is doing the M&T Stadium, where, they are doing a lot of things in the community, but I don't know the specifics. Nobody should be jumping the line for any reason.
Sort of a Prince George's specific question. Your office put out a release earlier talking about the efforts at 6 Flags setting aside numbers of vaccines and then calling people. In Prince George's County, there's some frustration. I spoke to a council member today, said 111,000 Prince George's are pre-registered. Nobody's answering the phone when these phone calls are made because they don't know who answers the phone anymore. How can that problem be solved? Because there is a growing feeling of an equity issue in Prince George.
Well, there's no question about that. Is why all the steps we're taking, the appointment of General Burkhead to head that up. There was a reason why our very first mass testing site was in Prince George's County. It's why our first statewide mass vaccination site is in Prince George's County. It's the first place we sent the National Guard team in to assist the county. The Lieutenant Governor will be in Prince George's County tomorrow at pop-up clinics at churches that they're doing in conjunction with Doctors Hospital. We're engaging Prince George's leaders in the process, as the General touched on. We're doing a major public information campaign to encourage folks. But let me give you an example of the problem we're talking about with the reluctancy. Prior to the opening of the Prince George's County site, we went to Prince George's County and said, our goal is to get you caught up. They're in last place on getting the vaccines in arms. It's not they had a huge supply of vaccines sitting on the shelf, so to speak, in the freezer, not getting into arms. And we want to help them in every way possible to do that. And the county executive said to me, we really have a hard time convincing people to take the vaccine. You were with me when both the county executive and I were in District Heights inside the Beltway in Prince George's County at the Giant Food, and you were talking to people in the parking lot. And many black residents of Prince George's County said, we don't want the vaccine. And there were, probably more than half of the folks inside the Giant in this black community were white residents, and there were a lot of reluctance. So we're working on all those issues. We're going to continue to do everything we can to support Prince George's. An example I started to say was we set aside just for Prince George's County, and we said, you guys are backed up, how can we help? We have days of asking them. They provided us with a list of 2,000 names that had pre-registered somewhere. We hired contractors at the state level to call them all 3 or 4 times over several days, made 6,000 some calls. Only 19 people registered for an appointment. Since then, I think we're now doing outreach to a broader group for them, and we've made 6,000 calls in a day to proactively try to convince people. More vaccines became available, and we only sent emails to the Prince George's County list. Only, no one else anywhere. Very few people took us up on it, but they did forward those emails to other people outside the county who immediately took them all up. So we're trying to attack this from every direction. It is a critical priority for us. We're having similar issues in Baltimore City and in Charles County. And it's really why we're talking about mass vaccination sites in all those counties and why it's a real focus of our efforts to get the counties involved in our equity effort.
Can I ask a Baltimore City specific question about a latest Inspector General report talking about the state's attorney, Marilyn Mosley, was found to be absent for 5 months while she was in office over a 2-year period of time. Do you think there should be more oversight into state's attorneys? And if so, how could that be done, or what would you like to see happen?
Well, let me just say, first of all, I don't, other than watching the coverage on the news, and I saw your story particularly on Fox 45 and others. If these allegations are true, it's outrageous and unacceptable. I know that the IG did an extensive look into it. I believe this is, although we're not, I don't have any knowledge of this, but it sounds like something that the state prosecutor probably has jurisdiction over, and they take up their own cases. They might have to take a look at that situation, because I don't see the state's attorney prosecuting the state's attorney.
Last question, Brent.
So you said earlier that these Maryland residents are sort of getting an improper picture of vaccine allocations. They're looking at the number of doses they're going to health departments, and that's not capturing a full picture. So why not publish, is there any intention of making more public the vaccine allocations to other types of entities? Yeah. People have a sense of where those other doses are going?
Yeah, we do that every day. It's not complete because, let me give you an example. The federal government, on their own, decided to send some undisclosed number of doses out directly to their federal pharmacy program, and hasn't told us how many and to where. So we have 2 metrics. One is the ones that we have directed to I showed you the Montgomery County, a couple 100 sites, and who did what percentage. Those numbers come out every day. We've provided it to every county. We've had meetings and discussions with the Maryland Association of Counties. I've had personal discussions with 4 or 5 county executives. All the information is available. We don't have all of it because there's other things outside of our control that are happening in those counties. But we do know that the numbers I just gave you are all public information. They're all put on websites. We can provide you any additional information you want, but we've just been gathering it recently because it's scattered all over the place. Hospitals, for example, big hospital systems, we allocated to them. They made determinations about which of their hospitals where to send them. So we had to track down how many of those went into Montgomery County hospitals or Prince George's hospitals versus Baltimore City hospitals. So they're digging through all of that. I think it's going to get refined and even more detailed and probably more accurate as we move forward. But we know pretty rough numbers. Like we had a real number on the number of people vaccinated. It's an exact number in Montgomery County, 89,000, and who did them. Who has how many left in the freezer is something that's changing every day or every hour, and it's a little harder to track, but we're trying our best to do that. Another thing that we don't have any control over is the Department of Defense and the VA are allocated directly from the federal government some amount of doses. We don't know how many, and they're doing their own vaccinations of Marylanders and other states. We're trying to get that clarity from the feds. I said earlier that we asked the federal government to get involved in vaccinating their own federal workers in the region. We have the NIH and the FDA, who are major facilities here in our state on the front lines, critical healthcare workers, who don't have any vaccines, and they're begging the state for vaccines. They're the top federal health agencies don't have vaccines. So when a county health department says we don't have any vaccines, and we tell them we don't have them either, neither does the FDA or the NIH.
Thank you.
All right, thank you. Thank you guys very much.